This program is brought to you by First National Bank of Botswana.
FNB, how can we help you?
Good evening and a very warm welcome to First Issues. Thank you ever so much for joining us on the program. Major economic disruptions brought on by financial calamities, wars and disease epidemics, amongst other issues, are known to produce both winners and losers. Take, for example, the great financial crisis that engulfed world economies a little over a decade ago. The United States of America households alone lost an estimated $16 trillion in net worth. Additionally, about 8.4 million jobs were lost, and perhaps most notable was the 7,000-point plunge in the Dow Jones Industrial Average. While the losses were very impactful, there were some winners as well. Emerging markets then, such as China, India, Australia, amongst others, were the winners. The Business Insider reported that this was because their banking systems had been less affected by the credit crunch. Well, this recent COVID-19 pandemic is no exception. This outbreak has been going on for less than a year, but it has severely shaken the entire global economy, forcing outlooks of growth to be revised down to 2.5% by the World Bank, with fears of a looming recession. Not only that, the pandemic has had a ripple effect on the health and well-being of people around the world, affecting their behavioral patterns and daily routines. Even so, these disruptions have created pockets of opportunities and wins for various sectors in the economy. To understand how in such troubling times there could be some winners, albeit with some losers, First Issues took to discussing this matter with analyst at the Institute of Race Relations in South Africa, Gabriel Crouse.
I suppose it's almost goes without saying that more businesses have lost than have gained overall in the economy in the SADC region, in Africa, and across the world as a result of the COVID pandemic. This is partly to do with immediate loss of life and drains on resources resulting from that, but mostly to do with the necessary lockdown that scores of countries have undergone around the world in order to avert the crisis. The biggest losers have been in the leisure industry, in entertainment, in travel, and in in-person services. The biggest winners have been those companies that have been able to allow consumers to get around the obstacles of not being able to interact face-to-face as a result of social distancing. So those are things like Zoom, Skype, internet-based resources and communications, as well as delivery systems to get groceries and other necessities to the home for people who can afford to use those companies as products. I suppose it's just worth underlining, however, that even massive corporations that have solid value-add propositions, that have good price-to-equity ratios going into the crisis, have been hugely undermined by the lack of general confidence. So what happens when people lose confidence in the economic system is they sell their shares, they want to get those assets back in liquid cash so that they can spend them on immediate needs or to cover other costs. And that results in other people selling their shares because they see the price going down and they don't want to hold on to assets that are losing their value. So we've seen across the world a reduction in stock exchange valuations of companies that really exceeds what we saw in the global financial crisis of 2008.
Crouse esteems that while the learnings for most businesses during this time could be financial, it is crucial to look at the importance of human life in driving the global economy.
I suppose the foremost lesson is the value of human life itself. I think that has been drawn back into focus in a way that sometimes we lose traction of. From an economic point of view, that really does have to do with the fact that human beings are moral beings and are willing to expend tremendous costs in order to save lives. And companies that sort of operate on the assumption that human beings are narrowly self-interested beings are going to be surprised by the global response to the COVID crisis, and perhaps will do well to heed this response and to think about the fact that it's people first. I think in terms of a more narrow kind of business lesson, it's fundamental that government forms the background framework within which business can be done. And governments have responded differently to this crisis around the world. Some have responded better, some have responded worse. It's already soon enough to tell that. Ultimately, which responses in terms of the finer details are going to prove to do the best job of saving lives and livelihoods is yet to be fully determined. But I think that businesses can learn from this the importance of staying connected to the broader body politic, of staying connected to the supply chain, even where it sort of filters out beyond the immediate narrow confines of who you're buying from and who you're selling to. The thing that binds that that gives that chain a structure, that gives it a shape that you can really get a mental grip on, as well as a conceptual understanding that gives you the precondition for thinking, how can we add value so that we get more customers, so that ultimately we get more profits, so that we can grow the business. That structure is called government. And I think this is a good time for businesses to reflect on the governments that set that structure up, and reflect on the ways that they can influence those governments to act prudently, to act wisely, and to serve the people best. And I suppose from a business point of view, maybe the best way to inspire those who lead us is to lead ourselves by example. And those companies that have been prudent and that have made the sacrifices necessary to put some extra away for a rainy day will be able now to keep their employees on the payroll even through this crisis, and will probably stand a better chance of emerging from it. That's at the mid-tier of business and the top tier of business. At the bottom, and we've seen this at the top tier in South Africa through billions being donated by some of our most wealthy citizens. At the lower income tier of business, I think the lesson that we need to look to government and that we need to look to coordinate to lobby government is even more clear. South Africa has millions of informal workers who have been left with no income, people who live hand to mouth. And in some particular details, I think this is because the South African government has overlooked them and let them down. And I think that those businesses are going to have to take a very hard lesson in the benefits of registration officially, and in the benefits of lobbying together to get governments to listen to them. Because in a time of crisis, a lot of people are making noise. It's easy for governments to listen to those sections of society that are the most well organized and that are applying the most direct pressure.
While the travel and leisure and aviation sectors are the potential biggest losers to this pandemic, it is perhaps essential to consider ways to optimize this time of grounding. Crouse purports looking into ways of value add to societies by these sectors despite being shut down.
The key driving force right now should be value add. How can we add value to society in this time of crisis? In a word, that's it. To unpack what that means, particularly for companies that have been grounded, there are kind of two branches. The one is there a way that we can continue to add value despite the fact that we as a business have been shut down? So if you're a hotel, for example, now is a very smart time to think about preparing yourselves to offer services to people who need to self-isolate but can't self-isolate. If you're not getting customers in to come and stay in your hotels, but you can get the government to give you some payment to cover your costs so that people who are living in squalid, informal settlements and are infected with the disease but aren't showing severe symptoms. So they're safe themselves, but they're contagious and so can badly affect others, particularly the elderly. Those people need to find a place to stay. And I think there's room for leisure places to offer that to governments. And I think people should be proactive about trying to make those offerings. If you have the resources, to do it on a purely donation basis. And if you don't have the resources, to say to the government, look, we can't house and feed these people for free, but if you just cover our costs, that's going to give us some money to pay for our staff, to get the food, prepare the food, clean the bedding, maintain the hygiene, and at the same time, we're going to be doing a public service. That's an opportunity for value add that hotels in particular should be looking at. Airlines, very complicated. But to break down the most simple thing, I think that airlines need to look at how well they were doing going into this crisis and see if they can come out of it on top when travel returns to the state that it was in before.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
Cloth mask making has been turned into a booming business, selling the personal protective equipment to individuals who may otherwise not have access to medical masks, advertising their businesses on various social media platforms. According to an article by Joey Hayden for the Business Insider, the wake of the coronavirus has seen an underground economy of fashion designers, seamstresses and garage entrepreneurs monetizing this craft. As fears of contracting COVID-19 mount, it is not uncommon to see individuals donning masks everywhere you go, at malls, at the workspace, and on the streets. This has also extended to seeing people in their cars, driving with their masks on, even when they are alone in it. Talk has been swirling that mask wearing offers better protection against contracting the dreaded coronavirus. While some may be taking advantage of a dire situation to make money, the users may be encouraged by some message drivers doing the rounds on how using masks is their ticket to salvation against the COVID-19. One such message drivers are the Masks for All movement, who are based in the Czech Republic, a country that still has made wearing masks mandatory during the wake of Europe being one of the worst hit continents in the world. As a country that has made it illegal to not wear a mask, we wished to understand when is it the right time to wear masks, especially here in a country that has one of the smallest numbers of infected people.
Based on recent data, we know that population-wide use of masks is essential for suppression of the outbreak.
According to our professional experience, a simple homemade mask can prevent up to 100% of the spread of potentially infected microdroplets.
The more people use masks, the less virus can be distributed and fewer individuals are exposed.
Our guest is Peter Ludwig, who started the Masks for All movement with some scientists.
I read more than 30 scientific studies about face masks, and the science is quite clear. We now know that the main way how the coronavirus is spread is through little droplets that you spread around you when you talk or when you breathe. And we know that many cases are without symptoms. So basically people are spreading the virus, but they don't know that they have the virus. That's why face masks, even homemade ones, are very crucial to slow the spread of the virus. So basically, we tested this hypothesis in two main universities here in Central Europe. And we know that a mask that is made from your old T-shirt can stop about 95% of those droplets. So it's not about buying masks that are dedicated for healthcare workers, because those professional masks should be in hospitals. But this is about homemade masks. There are many tutorials online, and you can make your homemade mask that can prevent the spread of the virus. And our main claim of campaign Masks for All is I'm protecting you, you're protecting me. So basically, if we both have a face mask, the virus has to go through your mask, then there's air, and then it has to go through my mask. So you have two protection.
A study by two professors, Lisa Bordeaux and Margaret Siitsema at the University of Minnesota, says there's no scientific evidence that wearing a mask can actually be effective in preventing contracting COVID-19. What has been your data been based on?
I think that those professors were testing how the face mask can stop the virus. But this is not the key. The key is the spread of the virus from you to others. So basically, it can stop those droplets. So, and there are many new studies about that. And even CDC, that is the main authority in the US, changed its opinion. WHO also changed its opinion. Our work is based on recent data. And now there are many studies that are for wearing a face mask if you go out and if you are about to meet some other people.
The same professors purport that routinely wearing a mask may make individuals relax other methods of self-preservation. We asked Peter what his thoughts are on the matter.
Our experience from Czech Republic, that has 10 million people, is just the opposite. Because when people wear a face mask, they are already, they knew that there is a risk, so they are much more careful. Because if you meet someone with a face mask, then you do this social distancing thing. Because if you don't have a face mask, you often forget that you should have a social distancing. We have one of the best data from the whole Europe. We have only about 160 deaths in the whole history. And in the same time, Belgium, that has a similar population, they have 400 deaths daily. So it's like 30 times worse numbers. And the main difference is that we have a mandatory face mask. So we have not just the evidence from the scientific studies. We have the evidence here from this country and other. And now more countries are following. So there are more than 20 countries that made masks mandatory.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
The use of masks by healthy uninfected individuals has, however, led to stockpiling for everyday use of basic face masks to N95 respirator masks for everyday use. This, as was the case with sanitizers at the onset of this pandemic, has resulted in a shortage of masks for medical professionals who are at the forefront of this fight. While there are healthy people still scrambling for masks, the World Health Organization still stipulates that the only people to wear masks are those caring for infected individuals or those suspected to be infected. That being the case, the Center of Disease Control in the United States of America, however, backtracked on no masks on April 1st, following the exponential growth of the number of infected persons in the country. This has created a lot of confusion amongst the masses. Can using masks by healthy individuals protect them from contracting the virus? Are they effective? This is one of the questions we posed to our cardiac specialist, Dr. Kieran Baggett, to give his view as a medical professional.
Face masks have become a hotly debated topic in this time of corona pandemic. I think fears over developing COVID have led to our public hoarding masks, leading to a significant shortage for medical workers. Major organizations, including the Centers for Disease Control in the United States and the World Health Organization, have urged people up to use masks only if they are ill, so as not to spread the virus to others, or if you're a healthcare provider. That wisdom, I think, still stands, but recently the Center for Disease Control in the United States released new guidelines around April the 3rd, recommending everyone in the United States wear non-medical face coverings outside their home. This recommendation is voluntary and doesn't replace the current social distancing and hygiene measures.
We also asked Dr. Kieran Baggett what the safety standards are, considering that some individuals actually manufacture these masks from various cloth materials. In short, what material is considered safer?
A surgical face mask's main purpose is to keep out the liquid of an infected person's sneeze or cough from entering your mouth or nose. Wearing one can protect you from getting sick if you're in close contact with someone who is ill and could prevent you from spreading your illness to someone else. So it's common practice for medical professionals to wear them around sick patients. Face coverings, on the other hand, are meant to protect you in the same way that disposable surgical masks do by blocking large particles and respiratory droplets. These face coverings should be washed in hot water and dried on high heat between uses to kill any bacteria or viruses that get on them. Finally, the N95 respirators. This is where respirator, a tight-fitting protective device worn around the face, comes in. When people say respirator, they're usually referring to the N95 respirator, which gets its name from the fact that it blocks at least 95% of tiny particles, including viruses. These are the masks that are most strongly requested to be saved for medical professionals in our country.
As a medical professional, what should be the discussion around wearing masks, seeing that there's a shortage for medical professionals?
For me, as a physician, what is important is to address a supply shortage for doctors, nurses, and other healthcare workers before people buy their own masks. The public must remember that the shortage doesn't hurt healthcare workers, but all of us, because we need as many doctors and nurses as possible to stay healthy so they can treat and save people who are sick, not just with COVID, but with other illnesses too.
There have been some concerns that people are now disregarding other forms of self-preservation, which include washing hands, self-isolation and social distancing. We asked the good doctor what his thoughts are.
There is also a general concern that public masks could give people an exaggerated sense of security. Masks don't make you invincible, and they absolutely cannot replace good hygiene. Remember, wash your hands, don't touch your face, and practice physical distancing. Even in the Asian countries where widespread mask use is common, good hygiene and physical distancing have been necessary to combat the coronavirus.
This program was brought to you by First National Bank of Botswana.
FNB, how can we help you?